We're really good at collecting tools, and we're really good, as most practitioners, at applying tools. Where we fall short in healthcare is we don't have a standard system to assess. Pilots have a checklist. Engineers have a checklist. They all have algorithms in which they follow, so nothing is missed. We don't spend enough time, in my opinion, on assessing.
All right. Welcome back to Beyond Adjustments podcast. Today's episode, I'm just going to say it like right up front. This is one of those episodes where you might feel personally attacked in a good way, I guess. Like professionally convicted, not emotionally damaged, hopefully. We'll see. Because I'm sitting down with somebody who has become, he's a really good friend of mine, Tom Swales. And Tom has this ability to take things you already know and then make you realize, I'm not actually doing that. Anyway, early on in this conversation, we hit something that I think is a huge issue right now. Most people don't struggle because they don't know enough. I think we know that already, right? They struggle because they know too much and still don't apply it. It's like having 47 tabs open in your brain and none of them are loading, literally. We also get into the reality that what you do with a patient for a few minutes in your office is nothing compared to the thousands of minutes they're kind of on their own, right? The rest of the week. So if you've ever had a patient say, I felt great after I left, and then it came back. Yeah. We talk about why that keeps happening. Before we jump into all that, a quick shout out to Clear Cut Podcasting, because if you've ever tried to run a podcast yourself, you realize real quick, talking is the easy part. Everything else, not so much. Editing, audio, production, they 100% handle all of it so you don't sound like you're recording inside of a cereal box. Shout out, Clear Cut Podcasting. Love you guys. All right, let's get into part one with Tom. All right, welcome back to Beyond Adjustments. We are here with Tom Swales. So this is not his first time on the show. This is a repeat, we'll call it, of his initial appearance on the show. He was supposed to be on season 1, but we had just a ton of technical difficulties. The bright side is I got to learn a ton about him. So I know exactly what's coming. You guys are in for a really awesome ride. So no long setup here. Tom, welcome back to Beyond Adjustments. I'm just going to jump right in here, man.
Thanks for having me, Amin.
Yeah, absolutely. I appreciate you being a big sport about what's, the whole technical issues and just kind of jumping back in. But honestly, I'm big about the why, right? So you remember from our initial conversation, your story really matters. What brought you to where you are, the things you've walked through, your experiences, and you have a story, man, that should not be hidden. Like it literally should be shouted from the rooftop. So I want to start where, I always like to start, the why, right? So, but before the certifications, before the teachings, before AMT, and we'll get into that. We'll get into what all that's about. What originally pulled you into this world, or maybe, enhanced your outlook or your impact in this world? And what was the movement where, or moment, I should say, where kind of like the health stopped being interesting? Like, just kind of tell us about what brought you to this moment, like why you're here right now.
It always starts with curiosity, playing all the sports, getting a scholarship in soccer, snowboarding, all the stuff. I just loved watching athletes. I loved how they performed. It was magic. When you see the best of the best do what they do, you want to mimic and emulate that and then figure out how does it what they do so fluidly. So of course you'd go out as a kid and you would experiment, and I would go in the backyard and practice gymnastics. I just watched it and try and move like Michael Jordan, and then spin on my snowboard like Kevin Jones. And early on, having this ability to kind of break down movement in my head enough to kind of copy it to some level of competency, it made it fun. But there was always this drive of how do I keep sharpening this? How do I teach this? How do I break this down? What are the fundamentals that they do to give them the success? So that was the early on curiosity and enjoyment of it. I love sport, but I never loved enough of one sport to just, this is it. I just love doing everything. Forward, getting my degree in athletic training in the States, getting my master's degree for physio, and learning all about the rehab side of things and how to restore movement, how to reduce pain, how to improve performance. I blended the two of strength and conditioning, athletic training, physiotherapy, and then did all kinds of certifications. So early on was curiosity. And I knew that teaching people how to move better was the thing that got them better. We always tell people at our facility, we have two sides to our clinic. We have a rehab side, and then you go through a door, and then it's this big gym. And I tell my clients, I'm like, look, this is the side where we feel better. You get your manual therapy, your mobilizations, your manipulations. This is where we reduce pain. We change the inputs. So your nervous system is more receptive to change. And then I take them onto the gym side. I'm like, this is where you get better. If you don't know how to, set the spine, breathe properly, work on your balance, work on your control, lift, carry things, hang off things, it's going to come back. And then you end up back on my table. So that philosophy of curiosity into performance and then realizing that movement is the end game for everybody, because we all need to move. We all need to get off the table. That's it. My perspective changed when I got sick 2 years ago in 2023, and I lost my ability to move. I was bedridden. I was hospitalized. I had sepsis, heart failure, liver failure, kidney failure, feet went black, clotting everywhere, rhabdomyolysis, dialysis, respirators. It wasn't good. And 10 days in the ICU, 5 weeks total rehab at the hospital, had an ankle surgery. I went from 220 pounds to 170 within weeks because they're taking 3 to 4 liters of fluid off my body. So my body was literally, and I didn't have enough strength to get up out of bed. Everybody had to do everything for me. So, and that was my nightmare. Before kids, I never feared death. I feared disability. I feared losing my agency to move, losing my independence, losing my power. And that was taken away from me. That brought in a new perspective of when people are coming in injured, I had a greater level of empathy. But I knew that I had a lot of work to do coming out of the hospital and rebuilding everything back. So movement became this form of curiosity and enjoyment to, this is my agency. This is my independence. And I wanted that back. And I wanted it back so bad. So even though I had enough energy to go from couch or from bed to couch and read a book when I first got home, because I was still on antibiotics, and then whatever I could do, if it was go outside and walk on the grass for 5 minutes with my crutches, that's what I did. As soon as I had enough strength to get to the floor unassisted, I started doing rolling patterns and quadruped and whatever I could do. So I had to rebuild my body literally from the ground up. Sure. And I had to use the whole philosophy and everything that I learned and everything I developed. I had to put my money where my mouth was. So I'm like, well, no better subject than to just test my whole system and make sure I'm not full of shit, that I can do it. And then within 5 months, I put on about 40 pounds of muscle. I was back to doing my handstands, one-arm push-ups, pistol squats. I still had a lot of work to do, but in a short amount of time, which I didn't feel was that short, everyone's just like, you're doing so well. The key thing that every single specialist said to me in the hospital said, the only reason you're still here is because of how healthy you came in. Made me realize, all the work I've been doing, that was my number one insurance policy that I've been paying into. Because there were 5 other individuals who had sepsis that summer, my age, less stuff going on. They didn't make it. I was one of 5 at that hospital.
Wow.
And the fact, they thought they're going to have to amputate my toes and my feet because they went, wow. And the fact that I came out with all my limbs and my digits, they're like, this is, we don't see this. So, a bit of a miracle, but I also look at, okay.
A bit?
all the work. Yeah. Well, higher power saying you're supposed to be here.
Man, oh man.
You are supposed to be here. You have a purpose. Let's keep going forward. But My wife said, she's like, at least now you have a more interesting story. So I used that. But the thing is it lit a fire underneath so many of my friends. I'm 40, I'll be 47 this year. And all my friends who are middle-aged, they have kids, they're busy. They kept making excuses, putting it off. So many people came up to me after, I heard what happened. How did this happen? You were so healthy. It's like, well, because I put in the work. And immediately it's like they went to the gym that next day. They got memberships. They started walking. They started taking their health seriously. So it's like I jumped on this literal grenade for them to put a spark underneath their butts to not wait for tomorrow, start today.
Yeah.
To take it all seriously, because you never know. You never know. Like being fit, strong, having that capacity, that gives you resilience. And if another level of stress, like illness, comes in your body, well, you're so much further away from death if you have that capacity and that resilience.
Well, then how do you, like in today's climate, like in today's age, today's kind of understanding of how our health works, how can you help people in general, even, people in the field, clinicians, physical therapists, chiropractors, whatever, kind of understand that, resilience, like you said, isn't just physical. It's neurological. It's psychological. There's a huge part that, our brains and our thought patterns play into all this. No?
Yeah. We have to meet people where they're at. And we want to, the first part of every appointment, we're going to have a conversation. I'm going to ask questions. I'm going to dive deep into who they are, where they've been, their past injuries, past traumas. Even if it's 20 plus years ago, I want to know about the car accident, because that old injury, that old whiplash could be causing or contributing to the new low back pain or the new knee issue. And once they feel heard and they've told their story, well, now they trust you. Well, now there's trust, there's connection. If there's connection, there's safety. So now they feel safe in your presence because they're coming in vulnerable. They're coming in, they don't know you, but they're going to spill and tell you all these personal things. I have to do a good enough job to communicate, both verbally and non-verbally, so that they trust me. And then once I have their trust, their nervous system starts to shift from that sympathetic fight or flight to parasympathetic. Great. Well, now that we've shifted your nervous system, anything I do, when I look at how you move, when I apply manual therapy, the body's going to be more trusting to let me in to make changes, to accept those inputs. Because really, the nervous system's job is survival. And it's always looking for threats.
Yeah.
And if they feel threatened, it locks and guards. So then anything I do, if I don't connect with them, I don't make them feel safe, their body's going to push back against me. It won't accept what subconscious is like. I don't know about this person. I don't really trust them. They're gonna stretch me here, make me move this, but there's this deeper distrust. I have to make sure that is instilled first. So we go on to the psychological component first. Then we look at the nervous system. Well, how do we do that? Well, movement, posture, these are all outward expressions of the nervous system. How's the body organized? How are muscles tensing up? Where's their weakness? What are they avoiding? What are they hiding? What are they protecting? And then we look at how they move. Why can't they bend forward? Why can't they stand on one leg? Right? It's just taking a snapshot of how is their nervous system organized. And then when we start breaking down the parts and the pieces, and we start to say, oh, you know what? Your left hip, it's got this huge capsule restriction, and you keep rotating into your lower back. Well, we need to change the inputs around that hip. So you rotate to the hip, not into your lower back. Or maybe there's an old neck injury where they can't pull into the neck and they end up rotating to their back, or they rotate into their knee. We're these physical beings, and we have to abide by the laws of physics. And if we're not moving in one body part, the body's very good at compensating and moving those forces or energy someplace else. Well, now we have compression, we have overuse, we have degeneration. So once we start to look at the body through a lens of physics as well, then we can start to figure out, well, why do they have this Achilles tendonitis? Why do they have this compression in the low back? Why do they have this, tightness or nerve tension in the arm? Well, it's because they're not moving or breathing or doing something else in the system that's offloading some of those forces, and they're just creating more movement to those areas that they can feel or that they can move more into.
I think this matters because it shapes really how we see people, right? not just bodies. I love that. I love how kind of deep you went into that. I think that's important. All right, I'm gonna pause this for just a second. And honestly, do you see what I mean? We're barely into this thing, and we already touched on why quick fixes don't actually fix anything, why patients stay stuck in the same cycle, and why what they do outside your office matters more than what happens inside. This is exactly why I knew this was going to be a good episode. But in order to keep the lights on, keep these mics hot, we've got to get a sponsor. Look at that. We've got one. This episode is brought to you by AI Local Boost. And if you're a local business owner, this is actually very similar to what we're talking about. You might be doing great work, but if your Google business profile is incomplete, if it's inconsistent, or just kind of sitting there, it's the equivalent of doing one adjustment and hoping it lasts forever. AI Local Boost literally handles everything, folks. Posts, images, review responses, the Q&A, FAQs, all that. All done consistently so you actually show up where people are searching. And if you want to check it out, go to AILocalBoost.com. All right, back to the episode. So first of all, thank you for sharing your story and being vulnerable and just kind of going into all that. I think we could probably have an entire show on your experience with what you walk through. And I wish we had the time, but unfortunately we don't. So I want to fast forward a little bit, right? So as you started practicing, and I know, and correct me if I'm wrong, the illness, the sickness that you fell into kind of happened a couple years ago. So you were already in practice, right?
Yeah.
Let's kind of talk about your experience before and after, and feel free to answer either or, both. But as you started practicing, kind of working, real humans, right?
Right.
Real pain, real expectations from our side, you're showing up to your place of business. Like what were some of the first things you realized weren't as simple as they were taught to you?
In physio school, and I'm going to talk from physio because that's my formal licensing and my degree.
Sure.
They teach diagnosis. They teach all the special tests. They teach about the anatomy, the parts, the pieces. But then they throw you into the world and they expect you to know how to put it all together. They don't teach you how to look at the body as a system first. It's a system of systems. We have nervous system, endocrine system, vascular system, fascial system. And when we just get so focused on those painful areas, we lose sight as why is that area painful to begin with? Because the pain is not the problem. The pain is a signal for change. The signal is saying, pay attention to me. Something's going on. Yes, I've overused this shoulder, this supraspinatus. I have a partial thickness tear, tendonitis in this. Why did that happen? Well, it could be the neck. Mm-hmm. Can they rotate their head? If they can't, they might be moving the shoulder too much. Do they have nerve tension? How's their breathing? If they're breathing like this all day long and shrugging, they're going to create changes in the mechanics of how that shoulder's moving. Can their T-spine extend and rotate, right? What's their pelvic and their posture? I'm just using the shoulder as an example.
Sure.
But if we don't look at all those parts and pieces that attach to the shoulder and contribute to shoulder function, well, then we're gonna make the shoulder feel good. We're gonna stretch stuff. We might strengthen the rotator cuff, but then they go out back into the real world, start moving around, it comes back. Because you didn't fix the system around the part that is getting punished. Mm-hmm. It's too pain-centric, and pain is real. I'm not saying it's not. But if we have a way to look at everything together and then look at what parts aren't moving, break those down, correct the parts, isolate them, maybe we got to do some local correction, and then reintegrate them back into the system and then check the system, how it's all working together again, man, it just gets so much easier.
Yeah.
It's frustrating because people will go to other professionals and they're working on them for like a year. And I said, well, did they check this? Did they check? No, they didn't. They just keep doing ultrasound or laser and they keep stretching it. I was like, you've been doing this for a year and we'll see them for 1 or 2 appointments. and changes happen immediately simply because I'm like, well, the shoulder wasn't the problem. It's this old whiplash injury or the pelvis is off kilter or whatever. Like you're just compensating into that.
Yeah.
And that fires me up a little bit because this happens to kids.
Mm.
I'll share a story. So a father that I treated in the past, he messaged me. He's like, I would really love you to see my son. He can't play soccer. It's been a year and a half. Things are getting worse. He's seeing, he had a fall in soccer and, he tweaked his back. So chiro was adjusting and whatnot. But it progressively got worse. And then chiro sent him to physio. And the physio was just like, oh, you just have tight hamstrings. You need to stretch your hamstrings 3 times a day. I was like, who says that? He's making the assumption, oh, he's just a lazy teenager. He needs to stretch. I watched this child. I said, yeah, bring him in. I'm in my office. I watched this child, 14-year-old boy, walk across the parking lot in front of my window. I said, something is compressing on that boy's spine. The way he walked. He comes in, slump test. All the neural structures are all wound up. Myotomes, gone. Like we test myotomes through specific muscles. L4, L5, S1, completely gone. On both sides. I was like, well, that's a red flag.
Sure.
Reflex, not there. Like these are simple red flags that they teach us in year 1 physio school to pay attention to. And he couldn't touch his toes. Well, because his brain was toning up his hamstrings to protect him from falling forward. He was using protective tone in his whole backside to hold him upright. So, okay, something's going on here. I said to the dad, something's pressing on us. In my head, I'm like, he has a tumor in his spine. He's like, no problem. I said, let's get some imaging. 2 days later, he's like, I got him in for an MRI. He's got a baseball-sized tumor on his spine. Got him in for surgery Friday. Comes back out the Monday. Within a couple months, he's back to being a kid playing sports. But what really irritated me is these experts made assumptions and didn't check. They didn't systematically check fundamental components of an assessment. I said, guys, this is non-negotiable. Like you don't skip a neuro scan, regardless coming in. Everyone's neuro until they're proven otherwise. And that really hit me up because that's something we weren't taken care of.
Yeah. And I think that you'll find that in a lot of like the medical professions, right? Even those that are, so chiropractic, physical therapy, doesn't matter. You find it more in the kind of the medical space where it's like, they just check boxes and send you on your way, or throw pills at the situation or what have you. But even in chiropractic, like I've noticed that, it's really the heart behind it. If you walk into an office that's a, conveyor belt type situation, well, those kind of things are going to get missed. I guarantee you that boy, whichever chiropractor he went to, was just checking boxes and, cracking spines and sending them on their way, thinking it's going to fix them when it's a lot deeper than that. Thankfully, we're surrounded by doctors that don't do that here. So thankfully that's the case. But I think so you touched on something really, really important there. When we don't get to the root cause of something, when we don't try to really find out what the problem is, what it really is, even if we can kind of help with the pain, and I say we like I'm a doctor, I'm nowhere near it. I'm the tech guy. But like, we try to mask it by, aligning a spine, fixing the neck, upper cervical, physical therapy, but then that's just masking the pain. You might feel some relief, and like you said, you walk out and it's right back where it started. So I think that overlap happens, right? In all professions, right? So, but from your perspective, where do you kind of, let's go kind of to the positive side of things, right? Let's talk a little bit about the concepts, right? That speaking of overlapping, let's kind of go over those concepts that do overlap with, chiropractic, let's say, right? Since this is a chiropractic show, but concepts like, adaptability, nerve interference, subluxations, right? Even if the language isn't the same, of course, but what kind of overlap do you see there from between these two professions?
So I do spinal manipulation. I did an advanced diploma for that. It's part of our scope of practice. So
Okay.
it's a great tool. I love it. Like when it's appropriate, it works magic. When
Yeah.
someone's really locked down, like it's a quick, hard reset. Dry needling's awesome for that too.
Yeah.
I like acupuncture. I like ART. I like they're great tools. We're really good at collecting tools, and we're really good as most practitioners at applying tools. Now, from learning all these tools over the years, I started to get more confused as to, well, what tool works best for the right person? Because some clinicians will get fixed on a tool and they're like, I'm an IMS guy, I'm a manip guy, I'm whatever it is. And they use that on every single patient. They find a reason to use that tool. But oftentimes it's not the tool that they need. Where we fall short as in healthcare is we don't have a standard system to assess. Pilots have a checklist. Engineers have a checklist. They all have algorithms in which they follow, so nothing is missed. We don't spend enough time, in my opinion, on assessing. I love the quote from Abraham Lincoln. If I have 7 hours to chop down a tree, I'm using the first 6 to sharpen my axe.
Yeah.
Right? Because if we don't spend the time gathering all the information and looking at what could be contributing, what's not moving like it's supposed to, what's not firing up, what's not stabilizing, you're going to chase around pain.
Yeah.
You're going to change how somebody feels through an input modification, which is manual therapy, manipulation, whatever you want to call it. It's going to feel good, but then they start getting out moving again and it locks back down or it tightens back up. Well, because that wasn't the problem. You didn't take care of the system, or you didn't find that linchpin that's driving the system to compensate or move the way it is. And then the pain comes back within 48 hours. We know that after we do some manual techniques, we have a short window for change.
Yeah.
We've changed how the nervous system is interpreting and feeling how the body's moving. Now we have to teach the body how to move differently. Now we have the opportunity to create that change more permanently. But if we don't do that, it's going to come back. So I look at tools as they're just input modifications. We have lots of fancy explanations of what's going on neurophysiologically and mechanically, which is good. It's helpful. But at the end of the day, we're just applying inputs. And whether the nervous system looks at that as a positive or negative, that's really up to the individual and the individual's nervous system.
Yeah. Well, and I also think and again, this kind of segues into another piece of the conversation I want to have, which is that self-awareness piece. It's not just their nervous system, but I think one of the pillars of your work, if I'm remembering correctly, is self-awareness, right? Not just kind of movement quality, right? And I think one of the things that you do is a SAM scan, if I'm not mistaken. So can you explain what that SAM, and I believe, is it self-awareness movement? Is that what it is?
Yeah, self-awareness movement.
And then why awareness itself is such a missing pillar in modern rehab.
Yeah. The research tells us the greatest predictor of an injury is an old injury, which I do agree. But what I've seen in my 20 plus years, the greatest predictor of a new injury is actually a lack of self-awareness. How often we have clients coming, this shoulder pain came out of nowhere. My low back just started out of nowhere. No, it didn't come out of nowhere. It's just you're doing something repeatedly that you weren't aware that you were doing. And then all of a sudden the signal got loud enough for you to start paying attention, right? Something as simple as working at a desk and looking at a piece of paper and typing or another screen, that's going to cause overstimulation of the cerebellum and the visual system on the left and inhibition on the right, simply from doing that thousands and thousands of times. Yeah. That's going to downstream cause tightness all on that left side. It's going to over facilitate, and it's going to cause inhibition on that right side. So people come in, they're like, I got low back, I got neck, but they can't turn their head the other way. Not because their neck can't do it, it's because their visual system doesn't know how to do it anymore. So all of a sudden we start getting them to move the opposite way and things start to balance out. The SAM scan is a short form. It's a 3-minute scan I created for my athletes actually, because they would come in, for training and they're like, oh, this is tight. And we'd have to spend the next 10, 15 minutes quick assessing, doing some manual intervention. But now we burn 15 minutes when we should have been training. So I started thinking like, what is a simple way that I can teach them how to do this on their own? So I took 3 cerebellar tests from the AMT. They're quick, Schreiber-Romberg, Fukuda. RCMs. Okay, great. We're looking at top-down control. If the cerebellum's clean, great, let's move on. What's the neck doing? Can you bend it? Is there any pinch pain pull? Yes or no? If there's restriction or pinch pain, okay, we have to look at that. Can you touch your toes? Can you back bend? It's literally a 3-minute scan. And what they're going to do next is they're going to note, you know what? I can't rotate to the right. Great. Now go check your T-spine. Now go check your hips. Okay, seated rotation. Oh, my Faber's test is off. Oh, hips don't rotate. Go do your banded hip mobility. Then go do some shin box. And then go do some fire hydrants. Now go scan yourself again. And the whole system starts to reorganize and everything feels clean and clear. Great. Now go warm up and let's go train. So I wanted to take that burden off of, myself, but I wanted to empower them so that they didn't need to run. When they left for the season, I'm like, I'm not going with you. But you don't want to run to the trainer or the therapist, be like, this is tight. If you have a way to scan yourself, if your body got imbalanced or something tightened up for whatever reason, you can go after it before it becomes a big problem. If we have a level of symmetry in our body and we're doing these bilateral symmetrical things like squatting, deadlifting, kettlebell swings, running, if there's restrictions in the body, it creates torque. Well, that torque will limit how much you move on one side, but it might force you to move too much on one side. And now we've got an overuse problem on one side, or we've got tightness. So by doing that, it gives them independence, but it also improves their self-awareness through self-assessment.
Right. But so what are the most common movement or awareness signals people ignore until like the pain forces attention?
The number one test that I just have everybody do is single leg balance.
Single leg balance. Okay.
Single leg balance. So many times people come in, I have them do single leg balance. I have them do it with their eyes open, eyes closed. Because single leg balance, we are bipedal creatures, but when we walk, we're on single leg. When we run, we're hitting the ground single leg with multiple times body weight. If single leg balance sucks, how well do you think walking and running is going for you? Probably not that good, right? So they don't even realize when they fall or fail the test, I didn't even realize my balance was so bad. My question would be, when was the last time you checked it? Oh, they don't, right? And single leg balance, all the systems have to come into play. And when you take away the visual, your vestibular and proprioception systems have to pick up. But if you fall after less than 10 seconds on one leg, well, maybe we should do something about that. Maybe it's a foot reception problem. Maybe it's a hip pelvic control problem. Maybe it's a neck position problem. At least then it's telling us, it's like a blood pressure cuff. Blood pressure doesn't tell us much. It just tells us if the system is happy or not. Because if blood pressure is high, that's the first signal saying something is off. The system is overdriven a little bit more. We should probably figure that out rather than take blood pressure pills. So when we do these kind of fundamental movement scans or the scan, it's like just checking in. It's a quick check-in. If everything's good, feels good, nothing's pulley, everything's moving great, go do stuff. But if it's not, maybe we clean that up because it's only a real problem, especially when you get into high intensity stuff. So little asymmetries for most people aren't a huge issue. But when we start getting into velocity, when we start lifting heavy weights, and now those little imbalances will start to creep up over time because those loads will start to degrade tissues that are maybe getting overused or underused.
So with awareness still on the mind here for even for the chiropractors listening, how can awareness-based tools really be integrated into a routine visit, without really overcomplicating their care?
I mean, when you get good at it, it takes less than 3 minutes. And you can, some of my coaches, so this is integrated with some of the programs in the US. And one of the coaches was just like, I can't get my team to buy into this. I said, that's fine. Do one component of the test and then correct it. And then show them, oh, look, everyone can touch their toes. Great. Let's go train or let's go warm up. And then the next day, everyone, let's check your neck. Any pinchiness? Oh, you know what? We're going to do some isometrics. Let's get it because for headers, I'm going to use soccer, for example, we need to have a strong neck if we're going to be heading balls. So let's clean that up. So then over time, they're introduced one piece at a time. And then once they've been exposed to all the pieces, then it's easier to be like, hey, let's go through all of it real quick. So I just tell people, just do one part at a time. You don't need to throw everything new at somebody. Being a business owner, we've learned, we go on holidays, we get all these great ideas, we go do a conference. Let's implement all these new things. What happens? We're excited, but our team is overwhelmed. Like, what is going on?
Yeah.
So we come back, we're like, hey, let's make one change and let's see how that works. And then we'll add one more change and then see. So then you start to build that momentum in the team. But then by them doing it, they get comfortable with it. They start to bring down their defenses because this new thing that we're doing, it's not an extra thing. It's just giving them a tool to help make sure that they stay in the game.
How do you teach awareness to patients who just want to be adjusted or fixed and leave?
It's educating them that what I do in the few minutes that you see me versus 10,000 minutes that you have independently for the rest of the week is going to make minimal change. If their goal is to make permanent change and to move past their pain, create that independence again, then I'm honest.
Yeah.
I said, we're good at this. Dry needling feels good. Manipulation feels good. But how does it feel in 48 hours if you don't do these exercises? How does it feel that you have to come back next week and keep doing this every single week? I get it. It feels good. Like, it does. But at the end of the day, we shouldn't be dependent. We don't want to give up our independence to somebody that, I go see this person, they make me feel good. There's lots of professions that can do that, right? We don't need to give somebody money to be like, all right, touch me here and there and, pop this, stretch that, and, I'll be on my way. I get it. The body does need maintenance.
Sure.
But we also have to drive it the right way too. We'll use a car analogy. You drive the car off-roading and you go and get everything repaired and then you go drive it off-roading. It's going to get broken.
Yeah.
Right? If you don't drive it right or, do the right things to it, it's going to break.
Yeah.
But we have to do that very frequently.
Yeah. No, that makes sense.
Good, but not at a high frequency.
Yeah. And I think once that awareness is in place, really, I think is when the kind of that regulation really becomes possible, because now you're not just trying to get, Band-Aid type fixes. You're actually trying to find the real solutions and what have you.
Yep. And there are people who just want the fix and feel good. And, that's their MO.
Yeah.
Do the best job we can to keep driving home. I'm like, I need you to do this. I need you do like to be in pain. That's all.
All right. We're going to pause this one right here. But in part 2, this is where things really start to click. We get into nervous system regulation, why your body has to feel safe before anything actually changes, and how something as simple as breathing can completely shift outcomes. And I know what you're thinking. Breathing? Really? Yeah, breathing. Turns out the thing you've been doing your entire life, you might be doing it wrong. So if part 1 was good, part 2 is where it all comes together. We'll see you there.